we have today on the NHS Clinical Training Programme. I'm delighted to welcome our speakers today. In fact, let me do some housekeeping, then I'll get everybody to introduce themselves, and then we can carry on. So what we're going to do today is we're very fortunate to be joined by Laura, Susan and Lucy, who are going to tell us about the training programme with a few slides. After the slides, we can open it up to questions. We are recording this session, and this session will be, you'll find a copy on our YouTube channel in a few weeks' time. It is a webinar, so slightly different from normal lessons. So your cameras and microphone are turned off. If you want to ask a question, please can you do so at any time? So have you got a question, ask it and put it in the Q&A, not in the chat, as you might do on some Zoom sessions. So please put your questions in the Q&A to Laura, Susan and Lucy. We have a tight schedule today. This is the second of our panels of 7 today in the first of our 2-day Science Careers Fair, the second happening tomorrow in the Wolfson Medical Building, where we've got employers coming, so please come along to that. Anyway, let's get on with the session today. Can I invite Laura, then Susan, then Lucy to introduce themselves, and then once they've done that, maybe you can get on with your presentation. So Laura, if you'd like to introduce yourself and what your job title is.
Yeah, hi, I'm Laura. I'm a third-year trainee clinical scientist, and I'm based in Newcastle. I'm doing genomics as my specialism.
Thank you. Susan?
Hi there, my name is Susan Johnston, and I am a clinical biochemist in Glasgow Royal Infirmary, and I also work as the training officer for the STPs in clinical biochemistry in Glasgow.
Thank you. Lastly, Lucy.
Hello, my name is Lucy. I'm also a third-year trainee clinical scientist. I'm training in clinical biochemistry in Lothian, so I work in Edinburgh.
Thank you. And Lucy, would you like to share the slides now? And then I'll let you get on with your presentation.
Brilliant. Thanks, Lucy, for sharing that. So, yeah, my name's Susan, and I am a clinical scientist in Glasgow Royal Infirmary, so NHS Hospital based. And I want to tell you a little bit today about the role of a clinical biochemistry laboratory, the role of a clinical biochemist within that lab, and how you get into the scientist training programme, the STP. So let's just start with the very basics. What is clinical biochemistry? Well, it falls under the umbrella of pathology, or the study of disease. It's a very patient-focused service that's provided by a large team of healthcare scientists. So some of those team include medical laboratory assistants, biomedical scientists, clinical scientists and doctors, and we all work together as a team to provide this service. All the labs are based in hospitals and operate on a 24/7 basis. And what we're primarily concerned about are changes in the composition of the blood. So what is clinical biochemistry? We offer a huge broad spectrum of tests. We provide really quick results of high quality, and that's one of the fundamental roles of a clinical scientist, to ensure that we do this. And we interpret the significance of the data and provide advice to whoever's requested the blood, be that GPs or hospital clinicians. So what do we use these tests for? We use them to diagnose disease in patients. We also use them to screen for disease, so before the disease itself has even manifested and there's any symptoms. And we also use them, importantly, to monitor patients, so things like response to treatment, such as chemotherapy, and we can assess a prognosis. And we also dabble in some research and in clinical trials of drugs. So the process itself, what's involved in this? So it all starts with a clinical question. What is wrong with this patient? So usually start, if you imagine going to your GP, it'll start with a clinical history and a physical examination. So some questions about what symptoms you've been experiencing, and then you might get blood pressure checked, for example. Often a blood sample is taken. GPs, hospital clinicians can now request the test they want electronically on their computer, and they attach a barcode to the blood tube, which tells the laboratory all the tests that clinician wanted. And it then gets transported to the lab from either a hospital ward or a GP clinic, for example. The process itself can be divided into 3 stages: the pre-analytical, before we analyse the blood sample, the analysis itself, and after analysis. So before analysis, we have to book in samples in laboratories. We have to often spin the samples, centrifuge the samples to separate red blood cells from serum and plasma. The analysis, we do a variety of analytical techniques in a clinical biochemistry laboratory: enzyme assays, immunoassays, chromatography. Lots of different analytical platforms are used. Often now, because of the demand we have, as you can imagine, we have an aging population and many people who present to GPs and hospitals unwell. We've had to move to automation. So we have many robotic instruments, real state-of-the-art equipment that we use in order to provide rapid results for the doctor, in order to have better outcomes for the patients. Post-analysis, this is where a clinical biochemistry role. Can everyone hear the presentation okay? Do you want me to hang on, Fiona?
Thanks, Susan. Yeah, actually, we're getting some thumbs up.
Okay.
Thank you, Susan. It just seems to be a student called Mona who can't hear. And thank you for all the thumbs up. It's very pretty. Mona, I think, I'm sorry to say, it sounds like it could be your technology. So maybe if you want to, I mean, I know nothing, but I'm sorry you can't hear. It will be recorded, this session, so maybe you can see it at another time. Susan, please carry on.
No problem. So post-analysis, a clinical biochemist has a really vital role here, where we will interpret the results produced by the laboratory. Now, if you take Glasgow Royal Infirmary, where I work as an example, we get several thousand samples in on a daily basis. And more often than not, they're looking for at least 20 tests on each sample. So you can imagine the workload that we have on a daily basis. We couldn't possibly look at all the results. So what we do is we look at the abnormal results, and then we will act on them accordingly, whether that's phoning the patient's doctor or clinician to give them some advice. It might be adding on additional tests if we think we might. Essentially, we work as little mini detectives trying to work out what's wrong with the patient, and we will add value wherever we can. We will suggest additional tests, we will suggest a diagnosis, and liaise closely with the requesting clinician. So there are many areas in clinical biochemistry that you can specialise in. The sort of bread and butter or core biochemistry that we offer is offered in any laboratory, wherever you may be working. So we have smaller biochemistry laboratories in more rural areas. We have large teaching hospitals that are often affiliated with universities and cities. But we all provide a core service that's common to all. So these will be tests you're familiar with, things like getting your glucose tested to see if a patient is diabetic, tests of liver function, of kidney function. These are provided by all laboratories. But some of the larger labs have specialist areas, and these are just a few examples on this slide. So in Glasgow Royal, we have a huge endocrinology specialist centre, as well as a vitamins and trace elements lab. We offer specialist toxicology for looking at drugs of abuse, and a paediatric biochemistry lab across at the Queen Elizabeth, also in Glasgow. So these are often centred in large departments which act as reference centres, because that's where the technology is. Often we use state-of-the-art equipment and the expertise in order to interpret these results. So more onto the sort of recruitment side of things now, which I guess many of you will be interested in. So career as a healthcare scientist, I'd like to talk about now. There are 4 main areas: clinical bioinformatics, physiological sciences, clinical engineering, and medical physics. And what I'm here to talk to you today about in particular is entry into clinical biochemistry, which is one of the life sciences. But there are STP or scientist training program jobs available in all of these disciplines. So back in 2010, the way in which healthcare scientists were recruited and trained changed. There was a Modernising Scientific Careers document produced by the Department of Health. And this was really a UK-wide strategy to change the way in which healthcare scientists are trained. The ultimate aim is to meet the future needs of the NHS and provide a more flexible workforce and also flexible entry into the career. So the scientist training programme is a 3-year fixed term programme. You're employed on a fixed term contract and paid a salary during your training. So you're being paid to study effectively. It's a fantastic opportunity. You're salaried at Agenda for Change Band 6. So you can get details on that on any sort of NHS website. It's really varied training, so it's a mixture of work-based in your hospital laboratory as well as academic learning, and that academic component is provided by the University of Manchester, and you're fully funded to undertake an MSc in clinical biochemistry throughout the 3 years. You tend to attend on block release, maybe 4 to 5 weeks per annum. At the end of your 3 years, you hope to obtain a certificate of completion, and you can register with the Health and Care Professions Council to become a state registered clinical scientist. This is just a summary diagram from the National School of Healthcare Scientists website, and it's a nice summary of what you do in your 3 years. So in your first year at the bottom, these 4 yellow boxes, you will do rotations in all of the blood science rotations. So it's not just clinical biochemistry, you get exposure to the other blood sciences and are able to understand how we all work together. You then do some specialist rotations that are specific to biochemistry. So the subjects I mentioned before, endocrine, vitamins, drugs, pediatrics. You'll also complete a master's project that you'll submit to the university, and you'll attend university for 4 to 5 weeks per annum as well. You have the opportunity at some point to do an elective placement as well, which is a project of your choosing for a 4 to 6 week period that can be in really any healthcare science discipline or specialism that interests you. So how to get into the programme? I'll start by saying that it's highly competitive. You must have a 2-1 honours degree in a relevant science subject. Postgraduate qualifications are advantageous, but are absolutely not essential or mandatory. 2 out of our 3 first-year scientists did not have any postgraduate qualifications this year. Slide. So this is a bit about the recruitment process in England. So I'd advise anyone who's interested to check out the National School website. They recruit slightly differently to Scotland, and this is a summary of the process. They will advertise next year's jobs in January with a closing date in February. You have to sit situational judgment tests, and then they have shortlisting for interviews, which are usually carried out round about May. And you all start your training in September. In Scotland, it's a slightly more relaxed approach, although I have heard on the grapevine that we have tough interviews, but it's essentially a traditional interview that we offer in Scotland. We don't do the situational judgment test, etc. It's simply an interview, and we moved back to face-to-face last year also. So we usually advertise in March or April with a traditional interview in the May and the June. And again, starting in September along with your colleagues south of the border. The recruitment is funded by NHS Education Scotland. There's usually 20 supernumerary trainees annually in Scotland, but that's across all of the disciplines. We have applied for 3 this year for Scotland, and we're just awaiting the outcome. And certainly 3 of the big teaching centres, Glasgow, Edinburgh and Dundee, have all offered to host a trainee in 2023. So come January, we should know how much funding we have and how many posts there will be advertised. What's fabulous about the STP is we've been doing it for so many years. It's very structured and it works really well. when you complete your STP training, this is the sort of pathway to the top of your career. You would get a certificate of completion from the national school. You would become a state registered clinical scientist, and then there are a number of options. You can apply for a post as a clinical scientist that's usually full-time post, and there are also things called a higher specialist scientist training programme, which are 5-year fixed term. These are only offered in England at the moment. In Scotland, we prefer the approach of do your training for 3 years, then apply for a full-time role. You can work towards professional exams, your Royal College of Pathologists exams, and they are like a gateway to more senior posts. You can then apply to principal clinical scientists, and the very top of your career ladder is becoming a consultant clinical scientist. So it's very structured. One of the things that was very attractive to myself when applying to these programmes. A tiny bit about the day-to-day job, massively varied. We interface with hospital doctors, GPs, nurses. We provide clinical and interpretive advice. We also, as clinical scientists, perform some of the specialist analyses, and that includes developing, evaluating, and implementing new tests for the benefit of patient care. We participate in research, and we do a lot of teaching at universities, teaching within our own departments, teaching each other. And obviously in any science career, it's massively important to keep up to date with scientific literature and continue your professional development. And for those who reach the top, they're often actively involved in management. So here are some useful links for you to peruse at your leisure if you're interested in a career in clinical science. I've also put on there the Institute of Biomedical Sciences. I imagine many of you may be pursuing that as a career option, and obviously we work together with the biomedical scientists in the department. So now I'm going to hand you over to Lucy, who is a 3rd-year trainee in NHS Lothian, to tell you a bit about the trainee perspective.
Thank you, Susan. So yes, I'm Lucy. I'm a 3rd-year trainee clinical biochemist. I work over in Edinburgh. So Susan has very extensively covered the how and the what. So I thought I'd cover the why. So if my slides work. So I very much was in your position. I was at Glasgow for both of my degrees, and I went to the same careers fair run by Fiona every single year of my degree. And every single year I couldn't decide what it was I wanted to do. And every single year I went to every single stand, went through the same questions every single time. What do I want to do? Do I want to work in industry? Do I want to do a PhD? Do I want to do a non-scientific career? I really didn't know. And every single year they did the typical thing where they go, the only option is a PhD. You can only do a PhD. That's the only thing you can do. And I thought, well, I don't really want to do a PhD. And then I found the scientist training program, which when reading it sounded pretty good. And then I did a little bit more research and I thought, actually, this is probably the job for me. So why the STP? So it's a real life application of theory. You spend your whole degree learning things, and it feels a bit sort of redundant by the end because you have so much knowledge and nowhere to put it apart from in a dissertation, which then gets printed out and put away. So this job is real life application of all the things that you've spent so long learning. It's an opportunity to help people. You're working in a healthcare environment, and at the end of the day, the main reason for doing all of the jobs that we do is for the patient, to help them get better, to figure out what's wrong with them, and to become part of the patient pathway. So you may think in a lab you're not really doing much, sort of hidden away, but you actually have a very active role within clinical decision making. You, as Susan said, are a sort of conduit between the lab and the people making doing the tests and the patient and the doctor. So you are talking to the doctor, discussing the patient. Obviously, you don't get the opportunity to necessarily meet the patient, but you are very much involved in figuring out what's wrong with them. You also manage to get a master's whilst you're working, which is a very, very niche thing to do the STP. It doesn't really happen in many other things post-grad. And it's yet another opportunity. I know it's going back to university, but it's all very exciting, and the content that you learn is very sort of based around the job, and the job and the university degree come hand in hand. There's a wide variety of work experience and learning. As Susan said, your first year is very broad. You're trying out different specialisms. You're seeing how it all links together. And then you can take that back and apply that to your job. And then as you progress through the training, you become more and more specialised within what you're training to become. So within biochemistry, which is what I'm training in, I started off learning very much the bread and butter of the lab, biochemistry, genetics, hematology and immunology. And now I'm learning the nitty gritty sort of stuff, all of the things that I need to know to be able to do my job. And as Susan said as well, it's a progressive career path, and much like Susan, it appealed to me, the ability to do the training, then hopefully get a job, and then do the job, and then progress once you're in the job. So you're not stagnating. There's always something to look forward to, a goal, something to work towards. So this is a sort of pathway of me, and hopefully you guys too. So that was very much me up in the top corner, graduating from the University of Glasgow. I did a biochemistry degree in undergrad and a master's in cancer research and precision oncology. So whilst I was still at university, I was desperate to try and get summer projects and things. I know obviously they're the sort of golden ticket to things you always want to apply. All I would suggest with that is just keep emailing lecturers, keep emailing people, going and seeing people that you want to be in their lab. Just getting some sort of wet lab experience, I think, is always really key. It helps you with your honours project. It helps sort of orientate you within a research sort of setting. You obviously have your honours project. Obviously, some people don't really want to do wet lab work, but there's always the opportunity to learn something and to work on skills that are heavily important for whatever career you go into. And then sort of September, I would say, is sort of time to start networking, start talking to people. This job is all about figuring out what you want to do and talking to people, figuring out what they know, what their experience was, letting them have FaceTime with you. Then December, I would suggest you start thinking about your applications. It's a long process. The applications are difficult because they want to have the best people, because there's only 3 positions in Scotland. Obviously there's more in England, but I mean, it's still a tough course to get onto. Then in January, there tends to be an STP Open Day. Manchester holds the ones for life sciences. And I'm assuming that they'll do them in person now that we're hopefully over the worst of COVID. February, the English STP applications close. Then, as Susan suggested before, the English STP has shortlisting, so that usually happens in about March. Then they have an interview. The Scottish applications tend to be just slightly later. So if you were going to apply for both, helps you get both done within the same time frame. And again, that's the March, the applications close, and then you have the interviews for a September start. So I thought I'd give some reflections going into my final year, which is a bit scary. 3 years already done. Feels like yesterday that I was applying. So I have completed my core and specialist rotations. So I've done my clinical biochemistry rotation, my immunology, hematology, genetics, which were my first years. And then over the second and third year, you complete your specialist. So that's endocrine, disease of the major organs, which, much like most of the module topics at Glasgow, sounds very vague, but is actually very intense and lots of things to learn. And then there's toxicology, nutrition and pediatrics, and I've really enjoyed the specialist stuff. It's so interesting, and it's a lot more hands-on in the lab, which is really exciting. And I think there's a lot of you worry that you won't get an opportunity to get into the lab and get your hands dirty again, but it really is an opportunity to do that. I've also not done, but I'm in the midst of doing my project, which is really exciting. I'm working up an assay to measure fecal bile acids in the investigation of irritable bowel syndrome. So it's all very topical. Everything's very applied to real life, and you have a real role in making change and helping your department and doing exciting things. And you have a lot of independence when it comes to that. So you can really get stuck in with it. It's really exciting. So the best bits, obviously spending time in the lab, getting to know my colleagues. You really become part of the family. These labs for clinical scientists anyway, tend to be small groups of people. And so you really get to know your colleagues, and it's really nice. Everything's really friendly. I don't think I've yet met a clinical scientist that's not nice. And I think particularly in Scotland, because there's fewer of us, we're all quite a nice network. And yes, you get to be involved in projects that influence the running of the service, whether that's your own project, whether that's getting involved in the department, working on service development, etc. It's all just really fun, and there's a lot of variety. You never do the same thing every single day. You also get to spend time in other departments. You get to know other clinical scientists and then what other tests are performed in different specialisms. Susan mentioned the elective. I'm using my elective to go out into the hospital to see how the lab influences how the rest of the hospital works. So I'm spending a lot of time working with doctors, seeing what we can do to improve how we communicate with them, how we can better improve what we do for them, and also asking them what they could help change so that we can do our job a bit easier. So just trying to get that line of communication working a bit better. Unfortunately, there are some not so good bits, but that happens with everything. I think as a trainee, it's difficult to feel useful within your department because you're supernumerary. There's not really anything definitive for you to do that because you're not qualified yet. So there's a lot of time you have to spend doing your training and completing all the necessary things. But I think, as I said, if you get involved in little pockets, like any little project you could do to help people, or offering up yourself to support your colleagues, etc., is ways that you can feel useful. And then obviously there's the time of COVID. Laura and I had disruption to our training because of COVID-19, as did the trainees that have gone by in the years above us. But the national school has been really useful. Susan's been great. Everyone's been really supportive to help us get our training sorted and underway. And I think all that it's really taught me is that to be a trainee in the STP, you need to be flexible. You need to be able to work around things, because ultimately you're doing it because you want to be there. And so obviously sometimes things aren't going to go right. But that's really the only thing that I would say, is just that you can make good of the difficult bits. So don't panic. I know it's all a lot of information, and it's a big scary thing to have to commit yourself to 3 years of training, and it's hard to get onto, but people do it. Laura and I did it. So my tips would just be really research your specialism. Make sure you know what you're talking about if you get the opportunity to interview. The last thing you want to do is go into that interview and then go, what is a clinical biochemist? And you go, oh, I don't know. And then network. Make sure you're asking as many questions as possible. Show your enthusiasm. Show that you really know what you're talking about. Take your time with your application. Make sure you can provide clear and relevant examples. There's nothing worse than being vague. You want to show that you know exactly why you're applying and what you've got to show. And be yourself. They want to know who they're employing. They don't want to employ a robot. They want someone that's got all of the attributes, both sort of from your intellect and also your personality. So yeah, good luck. I will pass on to Laura.
Oh, I'll try and kind of be quite quick with this so there's plenty of time for questions. So yeah, I'm based in Newcastle and I'm third year trainee in genomics. So if we just go on to that. That's it. So firstly, what is genomics? So we study DNA to identify pathogenic disease-causing variants. The team includes a range of different individuals, from clinical scientists to the genetic technicians in the lab and lab assistants as well. We're a bit different to biochemistry in that we're based around a kind of Monday to Friday 9 to 5 service, largely anyway, and we work within genomic laboratory hubs. So my lab is in kind of partnership with Leeds and Sheffield as well, so we kind of service the whole of the northeast there. And it also involves both rare disease and cancer, so it's a big variation in the role. But the next one. So the use of genomic tests, we look at rare disease and cancer, as I said. We do a lot of disease monitoring. We do carrier testing so that we can predict the outcomes of pregnancies. We also look at prognostic indicators, for example, in cancer, and also predicting treatment responses so that the best treatment can be provided for patients. So we work mostly in offices at screens, and we interpret the data from the labs. This is a few examples of different things that we'd look at here. We don't really see patients. I did in my first year, so we did a genetic counselling rotation, which is another one of the STP specialisms. So they're the patient-facing side of our job, basically, and they communicate with the patients. They'll take samples and send it to us. We'll then process it through the lab, interpret it, and then report results back to them. A lot of it is team-based, so we work together with a range of different clinicians and things as well. We do a lot of MDT meetings and discuss results. It's a lot of collaboration involved, and we also do a lot of research and development as well as part of our roles. So my experience so far, my first year rotations included genomics, genetic counselling, bioinformatics, and then also some of the blood science side of things. So I did spend some time in biochemistry as well. The second year rotations, mine were a bit mixed up because of my project work. So my project was based around cancer. So I did that rotation earlier on. So as Lucy was saying, you do need to be really flexible with it. I think I was the only trainee in my year to be doing that at a different time, and I've not done the university teaching for it yet. So it's, yeah, you've got to be very flexible for it. And I've also done my prenatal genomics rotation. I've done a lot of my practical project work so far, which was testing a novel method of genome mapping against standard of care. So you really do get to contribute a lot to service development as well. It's a really good part of the role. I've now just started in my third year, and I'm based in the paediatric genomics side of things. So that's a lot of kind of testing newborn babies. I'm currently on what they call the floppy baby service. So it's testing for a lot of muscular dystrophies. So yeah, you really get involved in the service. And then next is my adult rotation and my elective module, which I think will be based in the kind of mitochondrial genomics side. So it's still connected to our lab, but I get to see how a different kind of side of it all processes things. Yeah. So I've just put in a quick case of one of the ones I've just been involved with. Obviously, this is all made up, but this is the kind of form that we'll get in with samples, and it'll have the patient details and the reason for referral, and we'll take from that what test to do. So this was one of the cases I was involved in just last month. So this is what is called a QFPCR, and we do this for common aneuploidies. So that would be for 13, 18, and 21. As you can see here, I've got the trace on the left. So that's the part we interpret, and we put our results into the form on the right. So if you just click twice, let's see. So as you can see here, these are the abnormal markers. So the first one at the top has a 2:1 ratio, and the one at the bottom there has 3 peaks where there should only be 2. So that's indicating that there is a trisomy present. So the next step, and again, so the next step we would do karyotyping analysis. So this allows us to determine whether it's a free trisomy or if it's a translocation, as this would determine like the recurrence rate to future pregnancies. So if there is a translocation, it's going to be a 50-50 chance, and the is a very low chance of a free trisomy reoccurring. Then if you just click again, so you can analyze it as it is on the left here. That's what a lot of people do here, or you can arrange it into the kind of classic karyotype images you'd see. So at the bottom there highlighted, you can see there's 3 free 21 chromosomes, and the arrows will just come up on the left. That's all of them in the cell there as well. So we would report that as a trisomy 21. So just back to the training programme itself. So at the end of the 3 years, there is a kind of final assessment. Before COVID, this was an in-person assessment where you'd go around different stations, a bit speed dating kind of like that. And you would have different stations with different topics, and you'd have to interpret results and things like that. But it's changed since COVID, and it's now a written reflection of your time completing the STP. And there's also an interview involved, which discusses the reflection that you submit, and then also 2 blind case-based discussions. So that's the kind of main thing at the end. And you've got all your competencies to do over the time as well, which is just writing up different things that you're completing as you go. And that will get submitted at the end. And then you either pass or you can, resit. So for the application, I think a lot of it's been covered, but I think one of the main key messages is to really get your enthusiasm across. One of the things I found really helpful for mine was to relate this back to the NHS values, because this is one of the things that the people looking at your application will really look for, that you're researching what the NHS stands for. and relating your experience to that. I also found the STAR technique really useful. So looking at a particular situation and seeing how you acted in that situation and reflecting on it. And just, yeah, getting as much experience as you can and really researching what you're going into to show you know what you're talking about and that you'd be a really good candidate for the role. And that's just some more of the useful links that I think Susan already shared, but yeah, it's definitely worth looking into before you apply and just, yeah, showing that you'd be a really good candidate for the role.
Great. Thank you, all three of you, for a great presentation. With regards to time, we have 7 minutes left, and I can already see there's some more questions, so I'm going to go directly to them. I think there's lots of, I did want to say I've posted some links from the careers site, one about the STAR technique that Laura's just mentioned, and also we have got a free, what we call selection test site where you can go on and practice things like the situational judgment tests before you actually use it in person. So create your own dashboard, go on to that link that I've put into the chat. So, wow, quick Q&As. So I'm going to start with the top. Is it possible, and if you could make the answer short, please, is it possible for international students to apply to the programme, and what are their chances? I'm not sure that's possible to ask, but can international students apply? Susan?
Yes, absolutely. Chances are as good as everyone else.
Thank you. Next question is the STP suitable for someone who has already received similar training in a foreign country? They said they've got an official certificate for it, but haven't been practicing. Any thoughts, Susan?
You would still have to go through the 3-year STP, as the certificates that you get are mandatory for becoming state registered. So an equivalent certificate wouldn't be suitable, unfortunately, but you're eligible to apply for the UK STP.
Thank you. Then Monira, hopefully I said that right. Is STP for those who completed their undergrad, question mark, or also for those who completed their masters, as it's been mentioned that a year of university education is included in the programme. Also, is STP necessary for those who want to get into the industries?
So yes, you can apply when you're finishing your undergrad. You can also apply if you have postgrad qualifications. What was the rest of that question? It's not really a route into the rest of the industries. It would be a route into your specific chosen discipline. So one of the life sciences, physical sciences, etc.
Yeah, and can I add, I don't know if it was clarified, but there are different STPs for different subjects beyond clinical biochemistry, isn't that right, Susan?
Absolutely. So we've provided, I suppose, 2 examples today from the life sciences, in particular blood sciences. So we've had genomics and biochemistry, but there's many different disciplines. And
those links have you put in the presentation, or where might they be found?
They can all be found on the National School website. Yep.
National School website.
Links all there.
Thank you. I'm going on to another question from an international MBBS students. Do we need full GMC registration to apply for the SDP?
So if you're a medic, then you would maybe be more interested in a specialist registrar post in clinical biochemistry, which would be completely separate from a clinical scientist post if you're already medically trained. Okay. We are a mixture of medics and doctors, but it's a very different training path.
Cool. And there's a question here from Amy. What is the role of a consultant clinical scientist? And to reach this level, is having a PhD essential?
No. So, because if entry into the program doesn't require a PhD, they can't require it or ask for it for a consultant. So in order to be a consultant, you must have completed all of your professional exams. So that's, you would work towards them at your own pace throughout your career. And a consultant has overall responsibility often for a section or a whole department. So still science-based often in many hospitals, but with all the management stuff that comes with it.
Thank you, Susan. Moving on, Catherine asks, what sort of work experience do you recommend looking for and where?
Very difficult to get work experience in the current climate, but speaking to as many people as you can within the profession is hugely advantageous. So speak to trainees, speak to people like myself who are training officers, visit departments. Work experience is very difficult and we understand that, so we're not looking for it on application forms.
Is it more transferable skills and potential?
Yes, so I mean, I think it's understanding the career you're about to get into. That's what we're looking for on application forms. Know what you're getting into, understand the STP, and just have spoken to as many people as you can.
Thank you. 2 more questions. For genomics, do you get any wet lab opportunities or experience?
A lot of it is just based around the project. I'm not really in the lab much other than that. And yeah, the qualified clinical scientists are mostly just in the office, but there are a few that kind of do a bit of both.
Okay, thank you. Another question, in terms of being based at Manchester University, is this remote or on-campus learning?
It's mixed at the moment for biochemistry, so it's mixed learning. It was virtual during the pandemic, and now we get a bit of both so that you can go down and meet your colleagues and your peers, which is really important, and then a bit of online teaching as well. Right,
and then Jessica asked a question. It says, you've mentioned that you are on one of the rotations in biochemistry. It doesn't quite make sense, Jessica. And immunology, can you apply directly to clinical immunology?
Yes, there are clinical immunology STP programs, yes.
Okay, thank you. Sorry, Susan.
Okay.
And then there's a question, we did talk about networking. Is it possible to be in touch with the speakers, maybe via LinkedIn or other formal platforms?
Yes, I'm old-fashioned and do not have LinkedIn, but yes, via email is perfectly acceptable, or a Zoom chat.
Okay, thank you. And I know Lucy's on LinkedIn, but do not. I'm always very keen on. Please connect formally via note rather than just informally. Can you do genetic counselling if you go through STP?
Yeah, there's an STP for genetic counselling as well. Yeah.
Cool. Right, I think one more last. Oh, I'm sorry, no more questions. We could go on all day. We have got a very strict timeline today. It is the 2nd of 7 speaker panels. So can I just really thank both Laura, Lucy and Susan for their time today. It's been a really stimulating session, and yeah, I think people have learned an awful lot. As I said, the talk will be on our YouTube channel in a couple of weeks, and so you'll be able to refer to that. Can I just also recommend that you come to any of the other panel talks today? In 15 minutes time, we're going to have a sports science panel, and then also there's the careers fair tomorrow in the Wolfson Medical Atrium, where there's lots of great science companies there from 11 till 2.